Hi, my name is Gregor,
And my name is Zach Thompson,
and we are going to be presenting our anatomy assessment on upper and lower body movements. I will be talking about the upper body movement, which is a pull-up.
and I'll be talking about the lower body movement, which is a vertical jump.
Starting with the lower, Starting with the upper body movement, which is a pull-up. The pull-up consists of three phases: the dead hang, the upward movement, and the downward movement. I will discuss all three, as well as the bone structure of relevant parts of the body to the pull-up movement. And I will also discuss sporting applications of the pull-up. Starting with the bone structure. The bone structure can be broken down into five areas. The shoulder region, which consists of a ball and socket joint connecting the humerus, clavicle, and scapula, allowing for a wide range of movement. Then we have the vertebral column, connected with facet joints, allowing for flexion and movement because of the multiple joints. These joints attach the cervical bones, so the C1 to C7, the thoracic bones, so the T1 to T12, the lumbar bones, L1 to L5, the sacral bones, S1 to S5, and finally the coccygeal to form the spine. Also in bone structure, we have the thoracic region, consisting of the sternum and 12 ribs, forming the rib cage. We also have the elbow region, consisting of a hinge joint made up of the ulna and radius in the forearm, connecting to the upper limb bone, the humerus. Finally, we have the wrists region, consisting of a modified hinge joint made up of the ulna and radius, articulating with the carpal bones, allowing for movement in the wrist. Now, moving on to the dead hang. The dead hang In the dead hang, the rotator cuff muscles, which are primary movers in this position, include the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. These muscles are concentrically contracting when in the dead hang. Similarly, the anterior dead deltoid, which is also a primary mover um, for the dead hang, is also concentrically contracting. At the same time, the erector supinae and the multifidus stabilize the lumbar and thoracic spine to prevent swaying in the dead hang position. Similarly, the rectus abdominis supports the spinal column when in the dead hang region. When in the dead hang region, there is a co-contraction in the elbow. This includes the tricep brachii, the brachialis, and the brachiodialis. Contraction in the elbow, co- contraction in the elbow. This contracting in the elbow. This includes the triceps. These muscles isotonically contract when the dead hang. Then we have the forearm flexor grip and forearm extensor grip, which are responsible for stabilizing the wrist joint, allowing you to grab the bar. For the dead hang, shoulder abduction is used to get into the position. The muscle that works in in an abduction of the shoulders are teres major, teres minor, latimus dorsi, the trapezius, and these are eccentric contractions, as there are elongated muscles, and these are also antagonists to the anterior deltoid, coracobrachialis, and the bicep brachii, which are all concentric contracting. This together allows the movement to happen slowly and controlled. Lastly, there's the abdomen region, including the rectus abdominis, internal obliques, external obliques, and the transversus abdominis. These muscles isometrically contract to help stabilize the spine extension. Moving on to the upward phase of the pull up, we have flexion of the elbow, including this includes the brachioradialis, the brachialis, and the bicep brachii, concentrically contracting um, whilst being antagonists to the tricep brachii. For adduction, the agonists in this movement are the latimus dorsi and teres major, which are concentrically contracting. At the same time, there is a there's the pectoralis major, which is a synergist with the before mentioned muscles. Now, for rotation and retraction of the scapula, this includes the trapezius, rhomboid major, and rhomboid minor. These muscles concentrically contract during the time of the upward phase of the pull-up. As for shoulder extension, during the upward phase of this consists of the posterior deltoid, which is a synergist um, with the medial deltoid helping to stabilize during the movement. Finally, spinal stabilization includes the abdomen region consisting of rectus abdominis, external obliques, internal obliques, and transverse abdominis. The also including the multifidus and quadratus lumborum and the erector cypne grip, as well as synergistically as well as working synergistically with the wrist grip. These muscles isometrically contract during the upward phase. Moving on to the downward phase, the first thing is shoulder abduction, which is controlled by the latissimus dorsi and pectoralis major, which eccentrically contract, and the rhomboid major and minor, the trapezius, which helps with stabilization and retracting of the scapula. These also contract eccentrically during the downward phase. Finally, the extension of the elbow is used in the downward phase of a pull-up. This includes the tricep brachii as an agonist and the bicep brachii, brachioradialis, brachialis, and coracobrachialis, all as antagonists. All these muscles are eccentrically contracting during the downward phase of the pull-up. Throughout every phase, um, throughout every phase of the pull-up, down, up, and the dead hang, the forearm flexors and extensors are contracting isometrically as they grip the bar. On to sporting applications. The pull-up can be used in a number of sports, including rock climbing, as it's essential for pulling your body up whilst doing so. It is also used in gymnastics for a muscle up or ring work or a bar routine. And it is also seen in swimming, specifically with the butterflies and freestyle stroke.
Lower body movement, which is the vertical jump. The vertical jump can be broken down into three separate areas: the hip, the knees, and the ankles. I will be discussing the skeletal and muscular movements that occur when performing the two separate phases of this jump, the downward movement and the upward movement. I will then talk about different sporting applications for the vertical jump. First, the bone structure. I will mention the skeletal involvement in each area. The hip is made up of the pelvis, the primary bone in the hip, the ischium, which is the bone that forms the base of each half of the pelvis, the pubis, which forms the lower anterior part of each side of the hip bone, and the two ball socket joints. These attach the legs to the hip. The knee is made up of a hinge joint, a one-way moving joint that connects the knee to the lower leg, a fibula and tibula, two long bones two long bones that sit just under the knee and connect your foot to your knee. The ankle is a combination of the fibula and tibula, but also a modified hinge joint which allows for a wider range of motion compared to the knee joint. It also has a talus, which is a small bone in the ankle. I will now talk about the muscles involved with this movement during each phase. During the downward phase in the movement in the hip, there is a flexion in the gluteus muscles, gluteus maximus, which is eccentrically contracting and is an agonist. Medius and minimus, as well as the abductors longus, brevis, magnus, and gracilis, are the hip adductors and produce an isotonic contraction. This makes them fixators, which help stabilize the thigh so that you have a solid base when performing the jumping movement. In the knee, we have the quadriceps, which is made up of the vastus lateralis, medialis, intermedius, and rectus femoris, which is also have and we also have the sartorius. Both these muscles are eccentrically contracting to control the rate of your knee flexion. These are agonists. These are agonists. Semimembranosus, semitendinosus, and bicep femoris are biarticulate muscles as they cross both the hip joint and the knee joint. They will be contracting at the proximal end of the muscle eccentrically and are working synergistically with the gluteus group. The inferior will be working as an antagonist and concentrically to take up the slack during the downward movement of the knee flexion. In the ankle, the gastrocnemius and soleus are eccentrically contracting and are agonists to control dorsiflexion, which is the back bending and contracting of your foot. I'm now going to explain how the muscles involved in the upward movement of the vertical jump. In the hip, you have the gluteus maximus and the superior portion of the hamstring group that are both agonists for movement and perform a concentric contraction. The sartorius and rectus femoris perform an eccentric contraction and are antagonists. They do this to control the motion. The gluteus medius and gluteus minimus are, as well as the hip, are abductors and are fixators to perform an isotonic contraction to stabilize the femur in the hip. As for your knee, you have the quadriceps, which are agonists and perform a concentric contraction. The inferior portion of the hamstring group are antagonists and perform an eccentric contraction to allow smooth movement in the knee. In the ankle, the gastrocnemius and soleus are concentrically contracting and are agonists to plantar flex the ankle, which is the movement of the ankle away from the body, the opposite of dorsiflexion. Tibialis anterior will be performing an eccentric contraction and is an antagonist. The landing phase is the exact same as the downward phase in terms of muscular movement. I will now be telling you more about the sporting applications involved with vertical jumping. In sports like basketball and volleyball, you have much more vertical movement, such as going for jump shots or layups when shooting the ball. Also, blocking, which helps not only in basketball, but also in volleyball, when you have to jump up to block a ball over the other side of the net. It's not just involved in other jump sports though. You've also got sports like rugby, football, and American football, where there are multiple different situations where having a strong vertical jump can help you in many different ways. This has been the presentation from Zach Thompson and Gregor Pert on our anatomical movements of the upper and lower body. Thank you very much for listening.